Diabetes mellitus is one of the most common chronic diseases in the UK, and its prevalence is increasing. We know that it is a condition in which patients have high blood sugar due to either the body's inability to produce enough insulin or its inability to effectively use the insulin that it does produce. Poorly controlled diabetes is also associated with multiple organ complications and reduced life expectancy, so it's very important that it's managed appropriately. In this video, I want to explore how diabetes was diagnosed and managed in the medieval era, when they had no scientific knowledge of blood sugar levels or the role of insulin. If you enjoy exploring how medicine has developed through the ages, then please follow my channel, Doctor of the Ages. So let's start by looking at how diabetes was diagnosed in the medieval times, without modern blood tests and lab analysis. It was actually urine testing or tasting that was a primary diagnostic tool during this time. Physicians or healers often would use the taste of urine to identify disease, and sweet tasting urine was associated with diabetes. Interestingly, in Greek, diabetes means passing through, and mellitus in Latin translates as honey sweet, referring to the sweetness of urine associated with the condition. Physicians may have also noticed symptoms like polyuria, which is frequent urination, or polydipsia, excessive thirst, weight loss and fatigue. But these symptoms were not always recognised as a distinct disease like diabetes, as they did not understand the underlying pathology of the condition. Diabetes was thought to be a disease of the kidney due to the fact that the patients would urinate excessively and have sweet-tasting urine. Now let's look at how diabetes was managed, given the fact that physicians in the medieval times didn't have a clear scientific understanding of the condition. Medieval treatments were quite often based on balancing the humours, and therefore physicians might have recommended a specific diet to try and balance the body's humours. This could involve reducing the intake of foods thought to be too rich or sweet. And although this may have helped to manage the condition to a degree, the concept of sugar and its role in diabetes was not understood at all. Various herbs and plants were also used for medicinal purposes, though they were not targeted specifically at managing diabetes. Bitter melon was used in some cases, and actually some studies have suggested that it may help lower blood sugar levels, potentially by increasing insulin sensitivity or reducing glucose absorption. Certain compounds in bitter melon, like charantin, are thought to have insulin-like effects as well, which could contribute to its blood sugar lowering properties. Fenugreek was also used, and we now know that fenugreek seeds are high in soluble fibre, which will help lower blood sugar by slowing down digestion and absorption of carbohydrates. Ginseng was another herb used, and again today we know that it can help lower blood sugar by improving insulin sensitivity, enhancing pancreatic function, and improving glucose uptake into cells. Physicians may also have recommended moderate physical activity to help with weight control, but these suggestions would not have been based on an understanding of insulin resistance or metabolism. In the absence of effective treatments in the medieval era, diabetes was often fatal. With the lack of knowledge regarding blood sugar regulation and no access to insulin or modern drugs, people with diabetes likely faced an early death, particularly if they had type 1 diabetes, where insulin would have been required to manage the condition effectively. Lack of treatment and high blood sugar meant that diabetic patients would be more likely to suffer with complications. So let's look into how these complications might have been managed at the time. One of the complications of diabetes, particularly in cases of poorly controlled blood sugar, is an increased susceptibility to infections. In the medieval era, if a person with diabetes developed an infection, they may have been treated with poultices, herbal concoctions, or simple wound care, including washing and bandaging. Herbs like garlic, honey, and vinegar were sometimes used as antiseptic, and even though these may have had some mild antimicrobial properties, they would not have been effective against serious infections that are usually associated with diabetes. These infections would really need treatment with antibiotics, which were not a treatment available at the time. Untreated bacterial infection and poor circulation can lead to gangrene, which is tissue death. And if gangrene developed, the medieval response could be drastic, such as amputation of the affected limb, although this was often a last resort. Amputation was highly dangerous at this time, as we can imagine, due to the complications like infection or shock, often resulting from the lack of antiseptic techniques or anesthesia. Long-term diabetes and persistently high blood sugar can lead to kidney disease or diabetic nephropathy, and this was not recognised in the medieval era. Symptoms like swelling, pain, or changes in urine might have been treated with general remedies for damp or humoral imbalances. Herbal remedies like juniper, dandelion, or other diuretics might have been used, though they would have had little to no impact on kidney failure related to diabetes. Diabetic nephropathy is another common complication that affects the eyes. Visual problems might have been treated with various potions or eye washes made from herbs like chamomile or rosewater, but there were no specific treatments or surgery available for diabetic eye diseases like glaucoma and cataracts. People with diabetes also often suffer from neuropathy or nerve damage, leading to pain or numbness, particularly in the hands and feet. In the medieval times, these symptoms would have been attributed humoral imbalances or evil spirits. Treatments might include herbal pain relievers like willow bark, which contains salicylic acid, a precursor to aspirin, or other analgesics available at the time. We now use specific types of nerve pain medication called neuropathic analgesia. These better manage neuropathy symptoms. But unfortunately, these treatments were not available at this time. So as we can now appreciate, the pathology behind diabetes was not understood in the medieval era. It wasn't until the 20th century that the scientific knowledge required to understand diabetes was available. Lack of knowledge and effective management meant that the complications of diabetes were also poorly managed and more prevalent. Treatment was focused on addressing symptoms rather than the root causes, with an emphasis on balancing the humours and using herbal remedies. Given these were largely ineffective, advanced complications like infections, gangrene and kidney failure were quite common. I hope you enjoyed this video and found it informative. If you did, please do like, share and subscribe to my channel, Doctor of the Ages.